Hello, my name is Benjamin. Today I'm going to be demonstrating trach care and suctioning. As I walk into the room, the first thing I'm going to do is perform my hand hygiene. Once I'm done with that, I'm going to introduce myself to the patient and explain the procedure that's going to be going on. As I'm explaining the procedure, I'm going to tell my patient that if they're having any extreme discomfort during the procedure and they need me to stop, they're going to go ahead and raise one of their hands. It's going to be the signal for me to discontinue the procedure. Then I'm going to check my chart and verify there is actually a need for trach suction that's been ordered by the physician. I've already closed my curtains to provide patient privacy, and I'm going to auscultate my patient's lungs to get a sort of a baseline for before the procedure. Now I'm going to go ahead and put on some clean gloves. Now that I've got my gloves on, I'm going to hook up my suctioning, which I've already done. I'm going to turn my suction up to about 115. I'm going to hook up my ambu bag to my oxygen, which I've already done. I would turn that on to about 15. Then I'm not going to actually do that for the video because I don't want the background noise. Then I'm going to take my tubing and I'm going to sort of occlude with my finger to make sure that I actually have good suction. At this point, now that I've got everything hooked up, I'm going to doff my clean gloves. I would normally put that in a trash can, but we don't have one today. Next thing that I'm going to do is I'm going to take a waterproof Trach pad and put it on my patient's chest. Now I'm going to open up my packaging. I'm going to take my saline tray and just put it right there. I'm going to get this out of the package, then I'm going to put on a pair of large sterile gloves because the ones in the kit are mediums and I wear larges. And of course I am aware that the purple gloves are not actual sterile gloves, but I may or may not have destroyed a pair in the attempt before this. So instead of getting a hole in one, I just put my clean gloves in there to simulate sterile gloves. And I'm going to go ahead and discard this. I'm going to put these medium gloves off to the side. Now I'm going to remove catheter from inside the bag, and I'm going to keep it in my left hand coiled up because my left hand is my dominant hand, so that's going to stay in my clean hand. I'm going to hook it up to my suction. And at this point, I'm going to take my ambu bag and I'm going to provide 3 to 6 breaths. Now I'm going to uncoil my catheter and prepare to insert it, and I'm going to suction for no more than 15 seconds at a time. Okay, now that I'm done with my suctioning, I'm going to intermittently occlude the valve with my finger and twist the catheter out, coiling it up into my hand. At this point, I'm going to disconnect it from the suction. Put that off to the side, and I'm going to provide 3 to 6 more breaths to my patient. Then I'm going to doff my sterile gloves with the catheter inside of them to preserve sterility. Those are going to go on the ground. I'm going to perform another round of hand hygiene. One thing I forgot to do is I forgot to lubricate the catheter and the saline. So normally what I would do for that is if my cylinder was already opened, I'd lip a little bit of it and put it in there. And I'd lubricate the first one to make the catheter using that same link. Now what I'm going to do is I'm going to get ready to change my cannula. And I'm going to put on a pair of clean gloves to remove the old one. Alright, I removed my old cannula. Normally I would do that when I took my catheter out, but I forgot to do it, so that can go there. I'm going to doff this pair of clean gloves, perform hand hygiene again. Now I'm going to get ready to change into my new cannula. First thing I'm going to do is I'm going to open up my trach care kit, preserving sterility, and then I'm going to open up my new cannula and drop it into the sterile field of my trach kit. And once again, I will not be using the gloves in the kit because they don't fit me. I just broke through by touching the outside of the glove. Normally that would not be such a struggle, since this is a fresh pair, they haven't been fluffed out at all. Bless you. Thank you. Right, now that I got those on, I can discard that. I'm going to discard my medium gloves. I'm going to take my sterile field and I'm going to unfold it. And I'm going to place my shiny side down over the patient. Now what I'm going to do is I'm going to insert my new cannula.